Hello guys, so this is my video in response to discussion about the Hippocrates and Galen. So basically those are the two scientists that we know of that had completely, not completely, but partially different views on how we perceive the disease and the treatment of it. So Hippocrates believes in more of a holistic natural approach. He thinks the disease is actually natural. It's not anatomical like the Galen thought, and he believed in this four humors. The questions basically was asking of whether the patient, so we have a patient who has a fever, right? And if I was the physician during the time of Hippocrates, how would I treat or perceive? So I found it very interesting after some review of both sides. Basically, me personally, I would take more of a Hippocrates approach as well, because I do believe that the way our body works is it is affected by a lot of internal and external aspects. If something is in pain, it's not just because that particular area is hurting, which could be the cause, some sort of an anatomical, like a cardiac arrest, or like a I don't know, pneumonia, because it's actually concentrated in the lungs. There's an anatomical aspect of it, but then what were the causes, and how could you be affected as a whole? So if the patient is presenting with a fever, I would consider, based on the Hippocrates knowledge and studies at that time, that it would be coming from those four humors that he was mentioning. Basically, that the like a bile or the phlegm in this particular case would be heated, and along with that, all the rest of the body would be heated as well, and that's what would cause the fever. So your body is fighting some sort of maybe a disease process, or because with any increase, as we know anatomically or from the biology, that with any decrease in temperature, that's what causes the microbes or the viruses to die. So that's why the body's responses in that way. So I would not only concentrate on the fact that the patient has a fever and I want to treat it with some sort of medication right away. I would look further, like what the patient was, what's the lifestyle is like, whether the patient is currently under stress, does his immune system has been affected in the past, time. Based on the knowledge of that, I would my treatment would be obviously rest if with any disease, or like a fever and just a cold. Of course, rest would be critical, reducing the stress. Maybe the sleep has an effect on it. Maybe the patient has a more of a mental disbalance, some sort. Could it be caused by chemical as well? So Galen comes in play here, whether there's actually an anatomical problem with the patient. Maybe he's got a fever not because of the cold. Maybe there's actually some sort of infectious process that's happening within the body. Let's say his appendix burst, and now there's a big infection within the abdominal cavity. So we would want to treat that so that's an anatomical issue, right? We want to treat that with antibiotics, right, in the surgical procedure. But at the same time, it would be very critical to approach also holistically to this, and support the body as a whole versus just treating the problem and the cause. So a further evaluation, of course, for this patient would be needed, whether it was something benign as just a simple cold, or something big, such as like a surgery would be required, like to rupture spleen, or could it be cancer? Could it be some other the actual disease that's causing this. So I so I think the combination of both the Hippocrates and Galen were both correct in their certain way, and its time and place. It has their approach has time and place. Um, yeah, so I think understanding their concept and their approaches would be can be built up on it for an individual care of a certain patient that would present in front of us. I hope that makes sense. And yeah, please comment below and see what you think. Thank you very much.